Hello, my name is Alan Martin, Clinical Director for Vigon. This short video will demonstrate the use of our neonatal PICC placement kit. We recommend its use for all neonatal PICC placements. I would now like to show you the pack contents. Here we have two absorbent drapes for cleaning the baby's arm, and this will collect any spilt povidone iodine. We have two drapes here to give maximum barrier precautions. Our new transparent drape, which I'll show you in more detail in a moment. Our fixation care of tegaderm and 3N steri-strips, a selection of swabs, two measuring tapes, one for pre-placement, i.e. non-sterile, and one for post-placement, sterile, our tourniquet, which is siliconized, which is very soft for the baby's skin, two gallipots, one for use of the povidone iodine or chlorhexidine, whatever your choice, one for saline. Secondly, we have a collection receptacle here for the collection of any dirty materials, and over here we have curved forceps or straight forceps for the PICC placement depending on your choice, scissors for cutting the dressing to size, and a 10mm syringe for any flushing. Hello again, this is Nita Newborn. She's been around the world with me many times. She's a fabulous lady and she's going to help us place a neonatal PICC placement kit. I will demonstrate in a moment. I'm now going to demonstrate the cleaning technique for the placement of a PICC. Please note the baby's arm has already been washed with warm soapy water and dried prior to the use of povidone iodine or chlorhexidine, your choice. Please note I'm double gloved. I will hold the baby's hand with a sterile swab and then start to clean the baby in a up and down motion. When I first trained, we used to do this in a circular motion, and making sure that I move around to the back of the arm, and we will do that 2 or 3 times. Now that I've cleaned the entry site, I'm now going to clean very carefully the baby's hand. And I will again do this 2 or 3 times. Before I place the drapes, I'm now just going to wash off the povidone iodine or the chlorhexidine with sterile saline. This will make sure that the baby's skin is not irritated. Now I'm going to place the first drape under the baby's arm. Like so. This then protects the area where I'm going to place the PICC catheter. The second drape completely covers the baby's body and torso. And thirdly, we have our new transparent drape. This has many benefits. One, it keeps the baby's heat in. Secondly, you can see the anatomical layout. This is placed over the baby's arm and taken up as far as possible. And as you now can see, we have maximum barrier precautions. The baby's arm is now ready for PICC placement. We can see the baby. We can also see the baby's colour. We can also keep the baby's heat in. The rest of the baby is completely covered, meaning we have now maximum barrier precautions. So we are carrying out the guidelines that we hope will reduce catheter-related bloodstream infections. Now that we have maximum barrier precautions in place, I just want to double check the length of my PICC catheter for accurate tip placement. I'm going to choose the basilic vein just above the antecubital fossa. I will lay my tape measure and follow the anatomical line, the natural anatomical line, to the mid-clavicular area, which is at this point here, and then down to the right nipple line. In this case, it will be 11 centimeters. I've now applied the tourniquet. I've found the chosen vein. This is the basilic vein. I now hold the baby's arm to restrain the baby,
and just to double check, that's the chosen vein. I have all my materials ready, my breakable needle, curved forceps, non-toothed, catheter. In this case it's the 1 French Premicath with a stylet in place. I have my syringe with normal saline ready for any flushing that I may need while I place the catheter. I take the shield off of the needle, dispose of that, hold the baby's arm, and now I want to cannulate the baby's vein like so. Hold the needle in place and then gently advance the catheter into the needle. Nice 1 centimeter push. Now at this point I'm going to release the tourniquet and continue to advance my catheter to the chosen position, and in this case it's 11 centimeters. I'm now at the desired position. I make sure that I hold the needle in place with a sterile swab. Bring the needle out of the baby very carefully, not to disturb the catheter. Support the needle, and now break the needle and peel away like so, and lift the catheter out of the needle, and then dispose of the needle into your sharps bin. At this point, just to make sure that all the blood is absorbed with my swabs, I'm just going to remove my tourniquet, and it is advisable, if possible, to just get a little blood return. This is not always possible with a catheter with a stylet, and then push pause to make sure no blood is left in the catheter. Now I'm going to remove the stylet, and the stylet is removed like so. Undo the lure and then bring the stylet very gently out of the baby's catheter, dispose of, and then reapply, and then push pause, and now we're ready to fix the catheter in place. We have now completed a chest x-ray on the baby, and the tip is in the perfect position. I'm now going to make sure that the catheter is stabilized, and this is an essential part of the procedure of PICC placement. Firstly, I'm going to curl the catheter at the entry site like so, very gently, and this is where I put my first dressing on. It can be very difficult for a one-person technique, so please bear with me. So I get my tegaderm ready, and I'm going to curl the catheter, and this is my first tegaderm at this point. Place my first tegaderm over and secure the catheter in place. Now, with this type of dressing, we can actually see very nicely the entry site, and we can monitor for any blood loss, and it secures the catheter very, very nicely. The next important procedure is to stabilize the wing of the catheter, and in this case I make sure I have a dressing like so. This protects the baby's skin, and now I will place a steri-strip like so, one this side of the wing, the second one the other side of the wing, and this technique really does enhance good catheter securement, preventing any pistoning of the catheter or any movement, and avoids dislodgement. I've not quite finished yet. What I'm going to do now is I'm going to put my final dressing over the top, like so. Remove the outer side of the tegaderm. This is now complete. Please note the catheter is in a circular motion. There's no interruption with the catheter, and this catheter is connected to a syringe driver delivering saline to keep the catheter patent. We've now completed the PICC placement, and one of the wonderful benefits of this new drape is that you don't have to cut it with scissors or pull it apart. This one actually peels apart, and I'm going to show you how that happens. You peel from this end, and then from the opposite end, and that's now completely removed from the baby, and that's the PICC placement completed. Thank you, Nita.